In 1956, crude oil was first found in commercial quantity in Oloibiri, present-day Bayelsa State, Niger Delta, Nigeria. There was widespread jubilation by the people of the community, the region, and by extension all Nigerians, that this blessing of the discovery of crude oil would transform the lives of the locals, the people of the region, and help to drive infrastructural development, socio-economic development of not just Niger Delta, but all of Nigeria. Unfortunately, more than 6 decades down the line, the people of the Niger Delta have been more impoverished than before. Their sources of livelihood destroyed. The rivers, the farmlands, the air, massively polluted. If you recall, Ken Saro-Wiwa, who championed the activism against SPDC, paid the ultimate price. The benefits that have been derivable from oil and gas exploration by the people of the Niger Delta has been increase in cancer, increase in cardiovascular diseases, increase in infertility, increase in respiratory diseases, kidney failure, heart failure, liver failure, and ultimately death. My daughter, as you can see her here, Bieye Renner Briggs, when we gave birth to her, it was at the peak of the black suit pandemic in Port Harcourt metropolis. My daughter, when she was born, could barely breathe. She finds it very difficult to respire. This poor air quality, apart from the recurrent and ongoing gas flaring by multinational oil and gas companies operating in the region, was also further worsened by the activities of artisanal crude oil refining that takes place in the creeks of the Niger Delta. So the activities of these artisanal crude oil refiners takes place in the middle of the night. That's when the concentration of the black soot is highest. And that's every night is a nightmare for my daughter and for us as parents. My daughter will be breathing as though she's gasping for air, like she wants to take her last breath. And as a parent, you just stand by watching your daughter so helplessly. And worse for me as a medical doctor, I go out every morning to my hospital, and all I do is to take care of sick people, help people. And I couldn't help my child. I watch my child every day, especially in the night. Even till this day, she still does not respire well. Most times she breathes through her mouth rather than her nostrils because it's always blocked. There are lots of people who are going through far worse things than my daughter went through, but they do not have the opportunity and the platform to tell their story. Therefore, I become their voice. I become the voice of the voiceless. I see this activism as a civic duty, especially because I'm a public health physician. I understand how environmental pollution impacts public health. And so for the past 6-7 years, I've been using my expertise to draw attention to issues surrounding pollution and health in the Niger Delta. Now I'm headed to my office, and I think that by now some patients will be waiting for me in the office. But we'll sort them out. That's what we do every day. But today is Tuesday. Every Tuesday we have what we call clinical meeting, where we, as a hospital, we discuss prevailing health conditions that we attend to and how best to attend to them, given the current trends in management of any particular disease. It helps us to remain updated on the current treatment modalities for common illnesses that we treat in our hospital. You know, our hospital is a primary care center in the university. So most of our patients are students and staff of the university, and communities are joining the university. So every Tuesday we pick a topic, a health topic that is prevalent in our center, and we discuss it in depth. It helps us to manage our cases better and to offer quality care to our clients and to our patients. So by 9:30 we'll start the clinical meeting, and then by 10:30 we are done. Then we'll now enter the office where we'll start the day's business.
And sometimes this feels shocking in my hand. I used to feel that.
All those things are part of the hypertension, okay? What works for you may not be what works for the next patient. Do you understand? So as we continue to see you regularly, we are checking whether the drugs we are placing you on is working for you. If it's not working the way it should work, we change it again until we find a perfect mix of drug that works perfectly for you. The point there is, even though they may have genetic predisposition, okay? Even though they may have genetic, even though they may have genetic predisposition, it should not manifest at the time. Yes. It should not manifest at the time it does. And we're believing very strongly that it manifested earlier because of the environmental factors. There are three basic means by which hydrocarbon gain entrance into the human system. Number one is inhalation. Number two, ingestion. Number three, dermal contact. The soils, most of the farmlands where oil pipelines pass through have been polluted. And the foods that are grown there, they have a way of concentrating these hydrocarbons. Okay? The cassava, the plantain, the vegetables, and all that. And then we consume them. When oil spills occur in rivers, the fishes concentrate them. The periwinkles, the crayfish, the oysters, the crabs, they concentrate these hydrocarbons and we consume them. Of course, we live around the riverine area, so our staple food comes from things that are readily available in our environment. And when these environments are already polluted, whether you like it or not, even if it's microscopic concentrations of hydrocarbon, they are there and we consume them. This is the University of Niger Teaching Hospital. It's a tertiary center. You know, in the medical profession, in the healthcare general, there are three basic levels of care. So the primary care, the primary health care, the secondary health care, and the tertiary. The tertiary is like the pinnacle. All complicated cases, severe cases are referred here. But this is where we have the consultants, the professors, the resident doctors, the nurses, all cadre of medical professionals are domiciled at the tertiary center. And just like the name implies, University of Port Harcourt Teaching Hospital. This is where doctors are trained clinically. You know, this is where consultants are trained. Because of the non-existent general hospitals around, we refer straight to the tertiary centers. Well, ideally, it's supposed to be from primary to secondary, from secondary to tertiary. Like I said, I feel like there's so much that is endowed in me that needs to really find expression for the good of the public. You can imagine the...
Sorry, hold on. I need to know what's going on over there. Let's just go. Let's go. What's that? What's up?
It was like there are protocols here that this university are supposed to meet some certain
Okay.
The effects of climate change. And the impact of climate change is manifesting most especially in this region as flooding. I would say that a lot of people were trained in our region, lots of lives, lots of livelihoods, lots of public infrastructure. And you can see in one or 2 years ago,
the east-west road between India and our other axis was perfect. Economic activities within the Niger Delta region was halted. That's how severe it was. All these are trashing that will trash on the road or we throw them inside the quarters will cause blocking of the buildings. When it begins to rain fall, they are ready to on everywhere.
We went ahead. That 100% was not commissioned by the group, but it was carried out by members of it. To research the impact of oil extraction on the region. In fact, our president seated in was the technical view of that research. That research revealed that 100% of the NCP men product whose blood samples were collected and analyzed all have hydrocarbon medium. Water in that community is impacted. The air is polluted. Yeah, and other food source is polluted.
We are currently in the Niger Delta, and River State is assumed to be the headquarters of the South-South. And where we are is, for a start, where we have the largest environmental cleanup anywhere in the world after that of the Gulf of Mexico going on in the Ogoni area. And that started as a result of the UNEP report on Ogoni that was released on August 4, 2011. And that project has been on, and to a very large extent, it's like one of the questions I'm about to answer to Business Day newspaper when I live here now. They have asked me to tell them what is it that is going on in Ogoni land by way of appraisal. So as part of that, I will say that I can confirm that the cleanup is going on. I can also confirm that resources, fund, is not the issue of high prep. And I can confirm that the challenges they are having is how to spend the money they have to address the environmental cleanup in the Niger Delta. That is because $1 billion was earmarked to carry out that project for the first 5 years. High prep was created in 2012, but actually took effect in 2016 when it was flagged off in Gokana, Bodo to be specific. And between 2016 to date, you will see that we have exhausted about 8 years. High prep is still struggling to spend $1 billion. And the $1 billion was meant to be spent for 5 years, for just 5 years. So the project is ongoing. Certain issues are also there, but it is very slow, not as fast-tracked as expected. And the reason is because High Prep is a project under the Federal Ministry of Environment. As a result of that, they are subjected to several public procurement processes that is slowing down the way they could procure services to carry out the cleanup, and that is also delaying them. And we've been calling for emergency to be declared on the cleanup so that certain laws can be relaxed for that project to move faster, but that has not been done so far. Just 2 days ago, on the 3rd of this month, a massive OSP also occurred in Eleme. Why I'm linking that is because I'm talking about High Prep. And this OSP that happened in Ogale, talking about at the Ogale manifold on the 3rd, affected High Prep Lot 1 in Ogale. So as we speak, the OSP from the Shell facility has not only impacted the environment of the Ogale people who are already in courts in the UK with Shell over the years for previous pollution. And as I speak, I think the case is coming up about next week or so, because I know that some leaders from Bieye and Ogale, where this thing is impacted, are preparing to travel to the UK for the hearing. As we also speak, an OSP occurred in Bukuma, a community called Bukuma in Degema local government area of River State in December 2024. Yeah. As we speak, the OSP is still ongoing.
At the time of independence, there was no reconfiguration, of the country in terms of the design, the objective. What are we about? What is Nigeria about? Communities were marginalized from the colonial times because of the objective of the colonial enterprise, was simply handed over to the local elites. From birth, certain opportunities, you're precluded from certain opportunities because of these environmental situations that you're thrown into. And I remember the words of one woman who part of the cohort that Kebekache worked with, in Otuabagi. And she said, if you cut my back, not be blood you will see, now oil you will see.